Welcome. My name is Petra Harvey, and I am the health educator at the Osteogenesis Imperfecta Foundation. One of the primary activities of the OI Foundation is to provide timely, accurate, and medically verified information to medical professionals and constituents alike. We are using this series of podcasts to provide information on a variety of topics related to the diagnosis, treatment, and life of people with OI. Each monthly podcast will feature an OI medical expert or professional. Today, our podcast features Cory Nourie, who is a patient transition social work coordinator at Nemours AI DuPont Hospital in Wilmington, Delaware. Cory has spoken at the last two OIF national conferences in the Youth Forum, Teen Center, and a separate breakout session. So thank you so much for joining us today, Cory.
Thanks for having me, Petra.
All right, we're going to go ahead and get started with our first question. Can you tell us a little bit about what you do in your role at AI DuPont?
Sure. So I'm the Transition Social Work Coordinator in the Children's Hospital. And what that means is that our patients, start as very small children from birth on, and as they're getting older and older, we need to shift the focus to start thinking about how they're going to manage their own health care in the adult world when they eventually transfer to an adult-oriented system. And so my role as the social work coordinator is to help address all the non-medical aspects of transition. So things about, the way I usually say it is what someone does for 363 days a year that they're not visiting their pediatrician. So thinking about what they'll do long-term for careers and education and legal matters and insurance and all the things about your quality of life. I get to focus on that as well as helping connect young adults to their adult healthcare providers and making sure they have healthcare providers who know about OI or whatever the other special healthcare needs may be, and they have access to the information they need to be successful.
That's very interesting. So we use the word transition a lot when we're talking about moving from the pediatric healthcare setting to the adult setting. What are we really talking about?
I think what we're really doing is thinking about a shift in the way people receive care. And so in pediatrics, typically the experience is that there's the child who is the patient, and the parents are the ones who are really talking to the providers, to the doctors, the social workers, the nurses, and the parents are making the decisions on behalf of their child. And transition is really a shift in the focus to say, hey, this young adult or this child is going to eventually be an adult. And so they need to start to accept more responsibility, get more involved in their health care, understand how to talk to their providers, to question their providers when necessary, to advocate for themselves. And so the entire idea of transition is to really prepare people over a long period of time, actually, to be able to be good consumers of adult health care and be able to be on their lives, and have great adult lives. It's not just finding a new doctor one day from a pediatrician to, let's say, an internist. It's really about this entire process of developing skills and taking on responsibility and having some hiccups along the way. That's all part of transition. But the goal is that really over a period of time, people are gaining skills so that way they can go be successful adults. And a lot of that involves around having the parents let go of a little bit of the reins of control as well.
That's great. Thank you. As young people with OI transition into adulthood, there's so many things that they need to take on related to their health care. Can you talk about that for a few minutes?
So, again, thinking about the way the focus is typically with young children is that the providers are talking to the parent or the caregiver who brings them in. One of the responsibilities that I always want my young adults to start to take on is something as basic as checking themselves into their doctor's appointments, to their clinic appointments. And so usually, people are in the routine of walking up to the counter, getting up to the counter with their parents, and the check-in person talks to the parents and says, who is here? And the parents answer the questions. And one of the responsibilities is that young adult can say, hey, hold on a second, ask me the questions, or tell the parent to go back and sit down and wait for them over in the waiting area. But they know their names, they know their address, they can confirm all that information, they know what doctor they're there to see and the time, and those are all things that, again, just that shift in responsibility says, hey, this is me as my own consumer, and I'm the one who's going to be leading this from now on. Other areas is young adults can get comfortable actually answering questions in clinic appointments. And this can happen from a very early age on. So if you have a child who's 5 and the doctor asks the parents, what's wrong with Bobby today? Bobby can tell you what's wrong at 5, if his belly hurts or his head hurts or his arm doesn't feel good. And so encouraging that young child to actually be the one who's directing their care and being involved in the decision-making is a really powerful thing that in the long run will really help in transition. Additionally, we want young adults to know their own personal health history and then also their family medical history. And we always joke around with the teens I work with that, when they were little, it didn't really matter about old people issues because they were still so young. But as they start to make that move into the adult healthcare system, those old people issues actually become much more relevant. And so if you have a family health, a history of having high blood pressure, then the doctors may start screening you differently than somebody who doesn't have a family history of blood pressure issues. And so encouraging that young adult to know their family history, and there's lots of different tools and resources out there available through the CDC and online to help people really capture that information, because sometimes it's hard to think about it and keep it all in your brain. And so I'm a big proponent of using any kind of tools or strategies like apps or cell phones to help keep track of information that you might not have all the time available to you, but when you need it, you really need it. And I know the OI Foundation has done some great things with putting together tools to help young adults keep track of that. So I would definitely look at those resources as well. Another area that young adults can start to take on more responsibility is around medication adherence and taking their medications. And that would also mean being the one who does it themselves without having to be reminded. And so it's not uncommon for me to work with a teenager where the parents are still putting out their medicine every morning for them on the kitchen counter. Or sometimes a mom will say, can you just tell her she really needs to take her medicine? It's her body and it's really important. And then I get to say, well, right, it's her body, and so she needs to understand that. And we start to talk about taking responsibility and, what are some tools or strategies that the young adult could use to help remind themselves to take their medication. Again, utilizing apps. There are so many different apps out there, or even setting your cell phone to have the alarm go off 4 times a day for your medicine. Any of those kinds of things are ways that they can get more involved. Same thing with refilling prescriptions. It's not uncommon for someone to go away to college, and then it gets time for them to get a prescription that needs to get refilled, and they're like, oh boy, what do I do now? Because their parent has just always been the one who's done it for them. So working on those skills before someone goes away to college. And also, similarly, if someone's going to college, to think about things in advance in navigating the system and what kind of accommodations or accessible features they might need in their dorm or in the dining hall. We have a lot of times where young adults have gone away and got established and felt like they were ready to go be successful, and then the next morning they woke up to get their first shower, and their shower chair didn't fit in the stall in their dorm, and their parents are already gone. And so we just always want to try to think in advance about ways people can get more involved and kind of troubleshoot for those areas. Also, if somebody has any kind of DME, durable medical equipment or supplies, for them to be the one who starts to refill those things or order them or talk to their company that has their BiPAP and talk about their settings and they need new tubes. All the things that parents have kind of done for the young adult over the years, we want them to start to get more involved in. And in a perfect setting, it's done with those parents or those caregivers still there as a safety net to help catch somebody. So I usually use the expression that you eat an elephant one bite at a time. And the idea of transition, with it being a process, is that these are all skills you're building on slowly, one after the other, and not that we expect everybody overnight to now be able to miraculously be in charge of everything and know all their information. But by working together over the years to start to say, okay, the parent sits back a little bit and says, I'm not going to answer those questions. I'm going to let you answer the questions. Just to work on those skills so that way, over time, eventually, that young adult is ready to go on to be as independent as they can possibly be.
That's very helpful. So I know you've spoken at the National Conference and the Teen Center and the Youth Forum, and those ages are usually 13 to upper 20s. What ages do you typically work with on an everyday basis?
So we're unique in that we actually have an age limit here at Nemours, which is the 21st birthday. And so typically I would like to talk to somebody by around the age of 16, and that's kind of late in the game, except hopefully their current regular everyday providers have started having these conversations earlier on. So continuity of care kind of conversation should really happen at 5 and 6 and 7 to say, okay, what are you doing and how much responsibility are you taking? And then by the time they meet me at 16, I can really start to focus on, all right, 5 years from now, here's what you need to be connected to. Do you know about voc rehab and all those kinds of services? with that being said, there are many times I get a call about somebody who's turning 21 tomorrow or somebody who turned 23 yesterday. And so it doesn't matter. I mean, people may feel like they're late in the game of transition, but it's always better to start sometime. And even if somebody's in their 40s, there's still ways that they can start to develop those skills.
That's really good information. What, in your opinion, constitutes a successful transition?
Oh, it's a tricky question. I think the definition of successful transition to me would be that we have people who are educated consumers of healthcare, working with their team. And sometimes, honestly, the team, it doesn't change between the pediatric system and the adult system. If someone's not bound by an age rule the way we are, there's sometimes someone who's 40 who's still seeing a pediatric specialist. And that's fine, honestly. I still want in that relationship for the responsibility to have shifted to that 40-year-old and for that 40-year-old to be the one who's navigating and being the self-manager. And so even though the doctor still may be a pediatrician or a pediatric subspecialist, that young adult can still be the person who is being spoken to as an independent, autonomous person and making decisions to the best of their ability. So for successful transition, I think people are living the lives that they want to have. They're connected to resources and supports that they need in their community. There's a lot of gaps out there where people don't know that there are services that are available. And with a condition like OI, that's why I love coming to conference, because people get a chance to meet other people who have OI, and they feel not so alone anymore. Because I think a lot of times, even if someone has a fairly common condition, it's a relatively isolating experience to have a special health care need. And so sometimes it's really easy to get wrapped up in the idea of, I'm the only one of my kind, there aren't services for people like me, et cetera. And my goal for transition is to help everybody understand, oh no, there are services for children, services for adults. You just have to get steered towards those services. And so in trying to explain how the adult social service system is set up differently than in the children's system, so people are used to the educational system where they're entitled to services because of an IEP. And in the adult world, people aren't entitled to services anymore. It's all based on eligibility. And so if you have somebody who has OI and they're applying to voc rehab, the vocational rehabilitation counselor may have no idea what OI is or never met anybody else who has OI. And so we have to do a good job of preparing people to be able to advocate for themselves, to explain their condition and explain the symptomology, so that way they go, oh yeah, I get it. I know somebody else who has something not OI but a similar condition. And I remember I helped them get accessible equipment for that job, or I helped them negotiate with their dorm manager for their college to make sure that they had an ADA compliant dorm and everything was, met their needs. So all of those things together, I think, make for a successful transition where people are really leading their own way, recognizing that as human beings, we all make mistakes. And that's part of being a human, right? And part of being an adult is to say, okay, I tried it, it didn't work, now we're going to go from here. And recognizing that that's all part of everyone's existence, and that we need to make sure everybody has a chance to fail in things and to feel hurt and to figure out, okay, that didn't work, what could I do differently next time? Which sometimes for somebody who has a special health care need, there's a lot of babying that goes on, and people thinking, I just need to do it for you. And the goal is to empower people to do it themselves or the way that they want to do it, which may not be how other people would necessarily choose.
That's great. For people who are not in the Delaware region, what other type of professionals could they try to contact? So people like you who do this type of work, if they're not the patient transition social work coordinator, what other type of professionals could they reach out to for this type of help?
So it really varies around the country. Typically, I would say that people should be connected to vocational rehabilitation, and that's going to give you a voc rehab counselor, usually is the terminology they use, and that's really focused on employment skills and continuing education. So everybody should be connected to voc rehab. They pay for college for some people. They pay for modifications to vehicles for some people. They help with job trials and exploration and all those kinds of great things. So great resources, people through voc rehab services. Other professionals they could reach out to is they may have some sort of transition coordinator through their school district. It really varies across the country. And then in the adult world, every state has what's called ADRCs, the Adult Disability Resource Centers. And anyone could call those ADRCs, which is through usually the Office or Department of Aging or Adults with Physical Disabilities, depending on what state you're in. And those people the ADRCs have benefits counselors or options counselors who could really talk about, okay, tell me what your situation is right now, and we will help figure out what you're eligible for and how to apply for that service, or is there a waiver in your state that's going to give you access to home health care that you otherwise haven't had. So those are kind of the big ones that people typically need to be connected to, as well as potentially, depending on their insurance situation, some sort of case manager or care coordinator, just to make sure that everybody is working together and that person is getting the services they need, and there aren't gaps, because it's very easy for there to be gaps.
Yeah, that's very true. So thank you so much for sharing this information. As you said earlier, the OI Foundation has information on our website for adults. It's the Take Charge of Your Health package. And Cory, do you have any other resources? I know you all have the video library.
Yeah, so we have the videos that we made, and actually there's a young man with OI in one of the videos around genetic planning and counseling. Other resources, there's Got Transition, which is a national clearinghouse of transition information and supports around the country. And then I would say really utilize what the OI Foundation has done, because you guys have put a lot of time and energy into them, and really good resources that are user-friendly both for adolescents and for adults. And so I really would encourage people to look at those for sure.
Awesome. Well, thanks so much for joining us today.
Absolutely. If someone wants to contact me because they have a question, no matter what state you're in, I am happy to field email questions from people. And so the email address would be cnouri@nemours, nemours.org. And if I don't know the answer, I probably can find somebody who does, and so I'm happy to help people all over the country with questions, because transition is a really big issue, and a lot of times things come up and you hadn't anticipated that, and so you don't know what you don't know until you don't know it. So if you have those kind of questions, feel free to email me anytime.
Awesome. Thank you so much, Cory.
Thank you.
All right. We'll be back for another podcast next month. Thanks for tuning in.